Well, breast cancer diagnosis takes individuals down a variety of personal choice paths. For those who undergo a mastectomy, breast reconstruction could be an option to restore their physical appearance as well as mental health. And joining us live to discuss the importance of having this conversation with your doctor from the UC Davis Medical Center is Dr. Salibian and Dr. Michelle Zaldana. Thank you so much for joining us this morning.
Thank you. We're so happy to be here.
Thanks for having us.
So again, a lot of folks may not even have this occur in their lifetime, or maybe they might know somebody who does. So it's good that we're shedding some light on this. How often is breast reconstruction? Is that something that even needs to happen after breast cancer?
Yeah, it's a great question. So it's really individualized choice. The purpose is for us being here today and for really being passionate about the educational component of this is for women to know their options. So we talk about breast reconstruction, but sometimes no reconstruction is very appropriate depending on your ultimate goals. So that's a discussion that a woman should have with herself, her loved ones, and her trusted provider as well.
Yeah, and I assume that a lot of folks who maybe they get this news and they start considering this option, first thing that comes to their mind is, how am I going to afford this?
Yeah, that's a great point. So, and it's often not known, but the Women's Health and Cancer Rights Act was a federal law that was passed in 1998, and it mandates insurance coverage of any breast reconstruction procedure. So that includes obviously the reconstruction of the mastectomy itself, that includes revisions for a lifetime, whatever that may be, and also includes what we call symmetrizing procedures. So sometimes women just have a mastectomy on one side, and we can do things on the normal side to make them look more similar, and that's also covered by insurance. So that comes up a lot, and it's something that's really important to know.
Now, Dr. Zaldana, this is not going to be for everybody. There's going to be, and not just a personal choice, but there's going to be some folks who maybe they just decide, I don't want to do something like this. How do you even have that conversation with your family members?
Yeah, so ultimately it's whatever's going to make you feel comfortable in your own skin. There are some women that maybe will choose to not have reconstruction and then can move forward well with that choice. And then when you start talking about reconstruction, you also have different options. So you have, what we'll refer to as implant-based reconstructions and using your own tissue reconstruction. So the actual conversation of it can really be very lengthy, and one that you should have with your trusted healthcare provider as well. And then ultimately taking that information home and really sitting with it and finding the best choice for you.
And this really goes a long way as well, not just restoring, I guess, what they would see their physical self, but also for mental health, correct?
Absolutely.
100%, and I'll talk to that in that there's been a lot of research, and it's not necessarily new research, that shows that women that have breast reconstruction have significantly improved quality of life, have significantly improved well-being, whether that is physical well-being, sexual well-being, psychosocial well-being. It makes a huge impact. That being said, it's a very individual, it's a very personalized decision, and I think kind of the better way to look at it is all women should know what their rights are, should know what their options are, have access to all those options, and then be able to make the decision that's right for them with support from their healthcare providers.
And we'll get you out real quick on this one. UC Davis has a lot to offer, so real quickly run down what the options are there.
Yeah, so together Dr. Salibian and I can offer a full range of options. We're both microsurgery trained, so that means using your own tissue for breast reconstruction. We also do implant reconstructions and can really, in our clinical space, offer you full education, again, about your options, about what would be right for you. We'll work concurrently with the breast surgeons and find the best option.
All right, Dr. Zaldana, Dr. Salibian, thank you so much for your time this morning. Really appreciate it.
Well, thank you so much for having us.
Thanks, Mike.